Monday, November 2nd. Welcome to our daily briefing here. We start out the new week and new month. J.R. Lewis with you on KLAM and KCDV with these programs that are heard in the 1, 5, and 8 p.m. hours on the radio. Robbie gets them uploaded to youtube.com/Cordova TV as soon as possible afterwards. And the good news, of course, is Cordova is continuing to recover from its bump in cases very, very well. Dashboard is showing us at 0 again after the weekend, and hopefully that'll stay that way. I don't know if there was much gathering for Halloween stuff or not, but hopefully not, or if there was, that it was careful enough that we won't see another spike in cases as a result. What we're going to go over today is the state, because, of course, we don't live in some kind of giant dome, and you can see a lot of what goes on nationally anytime you check in the news, but we like to go over the state numbers so we kind of know how things are happening in Alaska. And again, my primary interest in sharing this with you, I guess, again, is to help us learn from things that are not going well across Alaska so that we can avoid those things and do our best to keep our case counts low. So from the state's latest weekly report, it says overall, virus transmission across Alaska accelerated for a fourth week in a row. Hospitalizations, unfortunately, for COVID-19 started to rise. Testing is not able to keep up with new cases. In other words, they have so many tests they need to analyze that the backlog is growing. Alaskans should get tested immediately at the first sign of any symptoms. Testing is the best tool for understanding virus transmission and risk in our communities. And then most Alaskans are getting COVID-19 from a friend, family member, or coworker. So Alaskans should avoid indoor gatherings with non-household members, wear masks, and stay 6 feet from anyone not in their household. That's kind of the overall brief bullet points from the report. Now, digging into the weeds a little bit more, the section on how the disease has been spreading in Alaska, they say most new infections among Alaskans are from community spread, not from travel. And that's borne out, actually, in the daily numbers. If you've been following that, there'll be, I think like in Sunday's report, there were 349 total cases discovered, and 2 of them were non-resident. So again, they say most Alaskans get the virus from someone they work or socialize or go to school with. It says many cases do not have a clear source, meaning that contact tracers have not been able to identify where the person got the virus. This means that there are cases in Alaskan communities that nobody knows about. And this has been an ongoing warning from Dr. Sanders that while it's great to see zeros on the dashboard, that doesn't mean that the virus isn't around. And that we should say, oh, well, there are 0 dashboard cases, therefore we don't need to worry about protecting ourselves. Everything's fine. Cordova is isolated enough, et cetera, et cetera. Again, you just look at the Chivac example to know that things can get out of control in a big hurry if we drop our guard. And if you're not familiar with that, Chivac is a community with about 1,000 people that had a whopper of an outbreak for its population size. In fact, there was one day that they had more cases there than Anchorage did in one single day. Back to the bullet points. Many Alaskans who are diagnosed with COVID-19 report that they went to social gatherings, community events, church services, and or other social venues while they were contagious, but before they knew they had the virus. And then cases continue to increase the fastest among Alaskans aged 20 to 39. However, the proportion of cases in older Alaskans increased slightly again this week. This follows patterns seen in other states of increases in viral transmission occurring in younger age groups first, followed by increases in older age groups, after which typically an increase in hospitalizations and deaths is seen. while the state report doesn't come right out and say it, you worry that if younger people, again, are gathering, spreading it around each other, and then taking it home with them, that the older folks who may be taking more precautions then are at greater risk of catching it from a younger adult. So hopefully there's not a lot of that going on. But there again, the point of going over these state numbers with you here is to say, this is what's going on in Alaska. This is what people in other parts of the state seem to not be doing very well, so let's make sure that we do better. There's a section in this report on travel saying it's not currently thought to be a main factor in most new COVID-19 infections in Alaska, meaning that most Alaskans who get COVID-19 are getting it from social, work, or family contacts rather than travel. Travel for gatherings remains risky and gets more risky as cases rise across the U.S. The risk is from being in close contact and in closed spaces with others while traveling, as well as gathering with friends and family members indoors who may have COVID-19 and not know it. And then they remind Alaskans to follow Health Mandate 10.1 when returning from out-of-state travel, which I'm sure is on their website, covid19.alaska.gov, I believe, if you want to look that up and refamiliarize yourself. It hasn't changed in a while, but it can be worth a refresher. So finally, they say, what should Alaskans do? First off, anyone with even one new symptom of COVID-19, that's fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle aches, body aches, headache, new loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, or diarrhea. If you have even one of those symptoms, even if it's very mild, get tested for COVID-19 right away and immediately isolate yourself from others by staying home, staying away from others, and not leaving the house except to seek testing or other medical care. Tests are most accurate in the first few days of symptoms, so testing as soon as possible after the first symptom starts is important, even if the symptom is very mild. Getting tested right away also helps contact tracers move as quickly as possible. The next point is Alaskans can help contact tracers work to slow the spread of COVID-19 by answering the phone promptly and providing accurate information. And then finally, Alaskans should avoid gatherings, wear masks when around any non-household member, keep 6 feet of distance from anyone not in their household, and wash hands frequently to slow community transmission of COVID-19. So, our testing schedule again, 6 days a week. You can get a test at Elonka Mondays and Fridays from 2 to 3, so that'd be today, and Saturdays noon to 1. CCMC is testing in the mornings, if that's a better time for you, Tuesday, Wednesday, and Thursday mornings from 9 to 9:30. They continue to ask that you bring your insurance information with you because the clinics can receive reimbursement when that happens. And remember again that anytime you want more information on Cordova's response or statistics or the latest that our emergency management team has to offer, you can visit covid19.cityofcordova.net. And with that, we will conclude this Monday briefing. Thank you very much for joining us. These will continue as needed in the 1, 5, and 8 p.m. hours on the radio and uploaded to youtube.com/Cordova TV, our YouTube channel. Music is, regular programming, by the way, resumes now on the Clam and the Eagle. And again, we wish you a very good day.